Lyme disease is a bacterial infection that occurs when you are bitten by an infected tick. Early symptoms include fever, headache, rash, and fatigue. However, if the condition is not treated quickly, the infection can spread to your heart, joints, and nervous system. The disease is not pleasant to deal with, but if you're familiar with its effects, you will be able to get prompt treatment and overcome it quickly. This video will discuss Lyme disease symptoms, testing, and treatment, so be sure to watch until the end. Description and causes. Lyme disease is spread through back-legged ticks, also known as deer ticks, which are mostly found in the Northeast, Mid-Atlantic, Upper Midwest, and Pacific Coast regions of the United States. Ticks that are infected with the Borrelia burgdorferi bacteria may bite a human on any part of the body, but they will typically attack hidden areas such as the groin, armpits, or scalp. The tick must be attached to the human for 36 to 48 hours to successfully infect them. People who spend a lot of time outdoors in wooded, grassy areas are especially prone to Lyme disease. Bites are also more likely to occur during the summer, as this is when ticks are the most active. However, ticks will also be active during warm fall or winter seasons. Lyme disease is most prevalent in the Northeast and Upper Midwest part of the country due to the large population of white-footed mice and deer in the region. These are the tick's preferred hosts. It can also infect other species of ticks who can transmit the disease to humans and animals. Early cases of Lyme disease were first recorded in Europe in 1883. Since then, various manifestations were indicated, such as acrodermatitis, erythema migrans, lymphocytic meningitis, and so on. However, these conditions were not recognized as being symptoms of a single infectious disease until an outbreak of what was first diagnosed as juvenile arthritis, followed by a rash, was diagnosed among residents of Lyme, Connecticut. It is difficult to determine how many cases of Lyme disease occur each year. This is due to different criteria used to determine each case and various surveillance methods used to investigate them. While about 30,000 cases of Lyme disease are reported to the CDC by state health departments and the District of Columbia, it is suspected that nearly 500,000 people in the United States get Lyme disease each year. What are the symptoms of Lyme disease? Lyme disease symptoms occur in 3 stages, getting progressively worse as they go. Stage 1 symptoms will appear 3 to 30 days after the tick bite. The most common symptoms of this stage is a rash. The rash will appear as a circle that spreads outward from the center of the tick bite. It will resemble a bullseye. The rash will feel warm to the touch, but it will not be painful or itchy. Other symptoms that appear during stage 1 include fever, headache, fatigue, joint stiffness, muscle aches and pains, and swollen lymph nodes. Stage 2. If Lyme disease is untreated, it will advance to stage 2. Symptoms of stage 2 will typically set in 3 to 10 weeks after the tick bite occurs. This stage is also referred to as early disseminated disease. Symptoms of stage 2 Lyme disease include rashes that appear on other parts of the body, neck pain and stiffness, muscle weakness in one or both sides of the face, irregular heartbeat due to abnormal immune system in the heart tissue, pain that starts in the back and hips and spreads to the legs, pain, numbness, and weakness in the hands and feet, painful inflammation in the eye area, eye pain and vision loss due to unusual immune system activity in the eye nerves. Stage 3. The third stage of Lyme disease is also known as late-stage disseminated disease. It sets in 2 to 12 months after the tick bite. The most common stage 3 Lyme disease symptom in the United States is arthritis in the knees and other large joints. The pain and stiffness may last a long time, while other symptoms come and go. In Europe, people with the disease may experience a skin condition called acrodermatitis chronic atrophicans. It causes the skin on the back of the hands and the tops of the feet to become discolored. It can also spread to the elbows and knees. In some cases, it can cause damage to tissues and joints. The skin condition may occur 2 to 12 months after the tick bite, or it can take many years to set in. Lyme disease testing. If you notice a tick bite that has not yet become engorged, it's possible that the tick may have not remained attached to you long enough for the bacteria to take effect. However, it's important to keep an eye on it. Look for a rash forming around the tick bite, flu-like symptoms, and joint pain, which may be signs of Lyme disease. If you suspect you have Lyme disease, it is advisable to see a doctor. They will run a series of tests to determine if you are infected. Although Lyme disease is currently the most common arthropod-borne illness in the United States, clinicians struggle to accurately diagnose it due to its diverse manifestations and the limitations of blood tests currently available. Methods used include the following: tick testing. If you find a tick on you, you may take it to a lab. The technicians will be able to test it for disease-causing bacteria. However, if the tick is infected, it doesn't mean you have Lyme disease. It just means you should keep your eye out for symptoms. Blood tests. Blood testing for Lyme disease is a two-step process. The first step involves testing the blood to determine if it comes up negative or positive for the disease. If it comes up negative, no further tests are needed. If it comes up positive, a second test will be performed. A blood test will check to see if your body has produced antibodies as a response to the infection. However, it may take your body several weeks to develop these antibodies, so you may need to have another test performed later. Lyme disease treatment. Lyme disease is not pleasant to deal with, but it can be treated even in its later stages. It is rare for Lyme disease to cause any permanent damage. The condition is treated with antibiotics. The sooner you are given the antibiotics, the better your chances are of a complete recovery. Some patients may experience pain, fatigue, and difficulty thinking for more than 6 months after treatment is administered. This is typically a sign of post-treatment Lyme disease. Unfortunately, there is no cure for post-treatment Lyme disease. Antibiotics have not been shown to help. However, you can manage individual symptoms to gain some relief. In most cases, PTLDS will go away on its own in time. How do you prevent Lyme disease? Preventing Lyme disease requires minimizing the risk of tick encounters and tick bites. Here are the measures you should be taking. Avoid grassy wooded areas where ticks may be present. If you are walking through these areas, stay in the center of trails. Treat clothing and gear with products that contain 0.5% permethrin. Use EPA-registered insect repellents. Check your body and clothing for ticks after coming inside from the outdoors. Shower as soon as possible. Prevent ticks on pets by using anti-tick products and checking your pet regularly for ticks. If you find a tick, remove it right away. Keep ticks out of your yard by trimming vegetation on a regular basis. Wear light-colored clothing so you notice ticks that may have attached to your body right away. Frequently asked questions. Here are some commonly asked Lyme disease-related questions and answers. Can Lyme disease be sexually transmitted? There is no evidence that Lyme disease can be transmitted sexually. However, if there are ticks near the home or living inside the home, it's possible that sexual partners can both get infected. Are Lyme disease tests accurate? There are rumors that the blood test for Lyme disease may not be accurate. However, FDA-rated tests have a high sensitivity. In some cases, people may need to be retested if the antibodies are not yet present, but this does not have anything to do with the test being inaccurate. Can I get a test to find out if my Lyme disease was cured? Unfortunately, there is no test that can determine if Lyme disease is cured. This is because antibodies and bacterial DNA will persist long after the infection is gone. The antibodies will not make you sick, but they may yield a positive result. Lyme disease is not pleasant, but with the right treatment methods, it can be completely cured. Now that you know what to look out for, you can detect it early on to minimize symptoms quickly. How will you be keeping yourself protected during active seasons?